So when we look at this question, this is your static question. This is the select all that apply. When looking at this, let's talk about how we're going to approach it. So the first thing that you want to do is always pay attention to any type of priorities that come up. You want to identify the question that's being asked. In this instance, we'll go back to the actual question that's being asked. What is the priority intervention? That's the question that's being asked, and that's what you want to review. So when you're thinking about, so don't use ABCs or airway breathing circulation when answering questions or static questions or any prioritization questions. So the rules of prioritization are, you want to know that acute beats chronic. So if you have a person with chronic COPD and CHF, that's chronic, and then you have someone who has appendicitis, then that's acute, and then the immediate concern of appendicitis is the highest priority than a person who may have chronic conditions. If you used ABCs and chose COPD, then that's where you choose your airway breathing circulation, then you'd be wrong. Another perspective is that if you have a fresh post-op person that's 12 hours, that definitely beats a medical or any type of other surgical situation. So fresh post-ops are things that we always want to think about as a priority intervention. Okay, so the answers that it gives us are, what are the priority interventions? So we know that's not going to be one, and we're going to select all that apply. So your static questions are never select one, and they are never all of the questions that are going to be asked. So administering oxygen, you have another option to inserting a Foley catheter, administering furosemide, administering morphine sulfate intravenously, transporting the client to the coronary care unit, or placing the client in low Fowler's silane position. So let's talk about what things. So we talked about a strategy and what that looks like. Let's talk about some mnemonics that we're thinking about when we think about congestive heart failure treatment. So the mnemonic that I always like to share is the MAD dog. Morphine, amnio, digoxin, dopamine, diuretics, oxygen, and then blood gases, monitor blood gases. So those are things that we want to think about when we're going to be treating someone with congestive heart failure. So what do we know? We know that, note that the word was, what's the priority focus? Again, that's reviewing what the question is. What is it asking me? I'm not going to assume what it's asking me. I'm going to read the question because it's right there and it's telling you exactly what it's asking you. Don't read into it. So focus on what's asking. So you're going to focus on the client's diagnosis and recall pathophysiology associated with pulmonary edema. So with that, you're going to use your ABCs, airway breathing circulation, and you're kind of trying to understand what the priority intervention is with that. Like I said, it's never going to be one, and it's never going to be all of them. Of course, that doesn't, make it totally easy, but it's something to think about. So the answers are, we're going to administer oxygen, not in these orders, insert a Foley catheter. You want to administer Lasix, administer morphine intravenously. So the reasoning behind this is that with extreme dyspnea, tachycardia, and lung crackles in a client with heart failure, it shows that there's some pulmonary edema that's going on, and that is life-threatening. So in pulmonary edema, what's happening is the left ventricle is failing. So it's not sufficient. It has everything backing up, and so causing just an excess flow of blood to the lungs. Because of the accumulated blood, pulmonary edema is a manifestation. So oxygen is always prescribed, and the client is placed in high Fowler's position. So earlier I talked about when you're looking at a person who has shortness of breath, a low Fowler's silane position is definitely not going to be comfortable for them, and you want to make sure that you're comfortable. Now, let's just see. Okay, so the reason why you want to insert the Foley is because you want to monitor urine output. So you know that they are having this pulmonary edema, they're having way too much fluid in the heart. Whenever you have a situation like this, you insert the Foley because you want to monitor the amount that's actually coming out of them, because you want to, and then also you want to make sure that the Foley's working too in this instance. So it's inserted to measure accurately, and then your inter-IV administration, and then you're gonna administer morphine IV. So morphine has many effects. Of course, one thing is pain, it helps with the chest pain, but it also reduces venous return. So decreases preload. So the morphine is going to help to relax the vessels, and then it does stop from all of the blood going forward. So that's what morphine does. And then it also decreases anxiety, and then reduces the work of the heart. So there is definitely morphine is one of the items in the MAD dog that you want to think about. So as we look at the other items, transporting the client to coronary care unit, placing the client in low Fowler's position, transporting the client to the coronary care unit is not necessarily, is not a priority intervention, because you may have the intervention that you actually implemented probably may work, so that therefore you don't need to send them to a higher level of care. So another thing that you're going to want to think about is that placing them in a low Fowler's silane position is not conducive to someone who is having shortness of breath. You want to have them in a high Fowler's position so that they actually are comfortable.